Hello, my name is Dr. Douglas Clark. I'm the radiation oncologist here at CHI Health St. Francis Cancer Center. I've recorded this video to provide you information about your cancer treatment. I'm going to talk about radiation, how radiation works, how we get the process started, and then when I meet with you, I'll talk more specifically about the side effects and the number of treatments that you'll be having. Many people can feel a sense of anxiety with radiation because it's something very unfamiliar to most of us. But to put your mind at ease, there's actually forms of radiation all around us. Most people are not aware that even while you're sitting here inside this building, there's radiation from the sun that passes through the building. You can't see that radiation because radiation is basically a form of energy, a wave. And depending upon the wave type, the characteristics of the radiation vary. So some radiation we can actually see. It bounces off of things and passes through our eye. That's, for example, the light that's shining down above you in the room. That is a form of radiation. But most of the types of radiation you're not able to see. But there is radiation from the sun, although you can look up and not see the sun, that passes through the ceiling above you and is going through your body right now. If you've ever turned on a microwave oven before, that microwave oven uses radiation to cook food. It passes through whatever you've placed in the oven and it heats it. If there's a cell phone near you and that cell phone is turned on, that cell phone communicates through the walls and the ceiling of the building. And those radio waves that are transmitted and received by the cell phone pass right through your body. So you're actually exposed to radiation in many forms. Some forms of radiation pose no health risk to your body, and some, depending on the part of your body or how much of your body and how much radiation you receive, it can pose a potential health risk. How does radiation work? Well, radiation that we use to treat cancer, we direct it at the part of your body where the cancer is located, and it passes through your body. As it passes through, it interacts with some of the tissues. Your body is made up of 1 trillion to 2 trillion cells. Those are the small building blocks, the members of the community that make up you. And inside each of those trillion cells is your DNA. The DNA is a long strand of molecules that are all connected together. They contain the code for your body. Everything about you, your eye color, your hair color, your athletic ability, your intelligence, the functioning of your body, your risk for different types of diseases, all of that information is contained within that code. And the radiation that passes through your body can cause damage to that DNA. But even though the radiation can cause damage, we're equipped with little repair crews that go up and down our DNA constantly, looking for damage and repairing it. That happens in every one of the cells in your body, and it's going on all the time, even while you're sleeping. It's not just radiation, but there are many other things in our environment that can cause damage to our DNA. Viruses we're exposed to, cigarette smoking, alcohol, fertilizers, pesticides, things in the food we eat, the water that we drink, many things can cause damage to our DNA. In fact, if we did not have ways of repairing that damage, there would be nothing alive on the face of the earth. So it's very critical that we have those functions available and that damage is repaired. Now, getting back to radiation. Radiation can cause damage to the DNA, and that damage can potentially cause cancer. Why is that? Because inside that code of DNA within your body is also the small codes that allow a good cell to transform into a cancer cell. So believe it or not, every single cell in your body has the potential to become a cancerous cell. But fortunately, those little repair crews are working 24/7, repairing the damage so that your cells can continue functioning and remaining good members of your community. Now here's a difference between cancer cells and your good cells. I like to look at the good cells in our body as being like members of our community. Some of those cells perform functions. Some are teachers, some are doctors, some are lawyers, some are policemen, some are the military. They all serve a different function, and they all work together to make you. Cancer cells have undergone a transformation because their DNA has been damaged. And if that damage does not get repaired, then the damage accumulates, and that's how a cancer cell forms. I like to think of the cancer cells as the bad cells in your body. They're a little bit different than your good cells. The good cells maintain housekeeping that keeps everything in order. They keep their DNA nice and healthy. When damage occurs to the DNA, they fix that damage as quickly as possible because they're working 24/7, keeping your DNA nice and healthy, keeping their house in order so they can remain good members of the community. On the other hand, cancer cells do not repair that damage as effectively. And because they're multiplying and dividing, their energy is focused on dividing and spreading, they don't do a very good job of fixing that damage. And as a result, if damage is caused to cancer cells' DNA, they're much more susceptible to dying. And that's where radiation comes in handy in terms of being able to kill cancer cells. We can direct the radiation where the cancer is located, and when that radiation passes through your body, it causes damage to the DNA of the cancer cells. It's going to cause some damage to your good cells' DNA as well, but remember, the good cells are much better at fixing and healing the damage of the radiation because there's damage going on all the time, and they're doing a very good job of fixing that. That's why you're alive today. Now, if we can cause enough damage to the cancer cells' DNA and the cancer cells do not repair that damage, then the cancer cells ultimately die. Sometimes cancer cells are able to fix the damage and they heal themselves. That's when we get cancer cells that are resistant to treatment. But most types of cancer cells are sensitive to radiation and they do not do a good job of fixing that damage. Let's talk now about how we get everything underway. We may need to perform certain tests in addition to the tests you've had done already to further stage you and identify the extent of your cancer. That's very important in the radiation treatment planning. But once we have all the diagnostic studies done and we've got a very precise idea of where your cancer is located, the next step in the process is what we call a simulation. That's where we simulate your treatment. Most likely when you have your radiation treatment, you're going to be lying on a table flat on your back. And what we do to do the planning is we have you lie on your back and we do a CAT scan of the part of your body that we're going to treat. Those CAT scan images then give us a three-dimensional picture of the section of your body that we're going to treat. And we transfer those images to a planning computer. And once those images are in the planning computer, we will identify where the cancer is or where in those images we think the cancer might lie. And then we tell the computer using software, here are the areas where cancer is located. And this is the dose of radiation that we want to give to those sites. We also tell the computer using the software where the nearby organs are and what doses we're going to permit those organs to receive. This radiation plan is very specific for your body because although we all are shaped somewhat similarly, our hearts are usually in the same location, our spines run the same location, there are some variations from person to person. And of course, everyone's cancer is in a slightly different position or has slightly different extent of involvement. So those pictures that we take of you allow us to very effectively customize how the radiation treatment is going to be given to your body. And it's going to be very, very specific for you. So it's very important that we capture those pictures of you and then create the radiation treatment plan that's very specific for your body. It will take us about 45 minutes to an hour to take those pictures. We may need to create a mask for you, or may need to create some other special additional components that help us deliver that treatment. But it's going to take about 45 minutes to an hour. And as part of that process, we will also put some marks on your body, some with a pen, and then some that we call tattoos, where we put a small dot of ink on your skin and we just scratch the surface so that we leave a little freckle. We put some of those little dots on your body because we're going to need the pen marks each day when you come in for your treatment to help position you. But those pen marks wash off after 2 or 3 showerings. So it's important for us to have some permanent small marks that help us identify the original positioning of the treatment fields. Now when we take those pictures of you, we're going to create a plan in our computer, and that plan is going to instruct our machine how to move around your body and deliver the radiation treatment. Part of that treatment will be the actual machine rotating around your body into different positions and delivering the radiation. But as the radiation comes out of the machine, we have leaves that can move in and out of the path of the beam and change the shape. By being able to rotate the beam around you and change the shape of the beam, we can sculpt that radiation that's passing through your body, sculpt the dose around the cancer, and either avoid or minimize the amount of radiation going to organs that we want to keep healthy. So we want to try to limit any collateral damage the radiation causes and focus it where the cancer is located. Again, it will take about 45 minutes, an hour to complete that process. And then once we have those images of you, then those images are transferred to a computer where we do our planning. And it usually takes us 2 to 3 days to create the plan that we will use to treat you. That plan will become an instruction set that will tell the machine where to go and how the fields should change shape as the machine moves around you. We actually electronically transfer that plan from the planning computer to the computer that controls the machine. All we have to do when your treatment comes up is type in your name into the computer, and then that will summon that plan, and then that plan will instruct the machine. By having everything digitalized, it reduces the risk for any type of error to just about 0. And so it keeps our patients very safe, and it helps us deliver the treatments very precisely. As I mentioned, it will take approximately 2 to 3 days to create your plan. And at the time that we take the pictures of you for the simulation, we'll also ask you what time of day you'd like to come in for your treatment. Now, normally the treatments are given Monday through Friday, but occasionally if there are holidays, we might not deliver any treatment on those days. But there's no treatment on Saturday or Sunday, but 5 days per week. Now, the number of treatments you get varies substantially. Some patients we may only give 1 treatment to, while other patients may receive up to 9 weeks of treatment. And it varies depending on the cancer, the stage of your cancer, and a host of other issues. And all that decision making is done based upon studies that have been done over many decades. The radiation treatment is given at a very specific time. We have about anywhere from 15 to 35 patients that may be coming in for the radiation treatment. So when we do your planning session, the simulation, we'll ask you what time of the day you'd like to have your treatment. That will be your appointment time where you'll come in each day for your radiation therapy session. You will likely be in the building about 20 to 25 minutes, sometimes a little longer, sometimes a little less. But we'd like to get patients in and out on a very timely basis, because some people are coming for, as I say, 9 weeks, and everyone likes to be able to have their treatment on a timely basis. We like to keep people waiting as little as possible so that it doesn't interfere with your daily schedule. Now, what should happen if you have an issue and you're not able to make your appointment time? Please call us and let us know if there's going to be an issue, and we will try to work you into another point in the schedule. We never know what's going to happen in our life, Sometimes there can be bad weather, the car can break down, you might have some other emergency that comes up. But if you can let us know as soon as you realize you're going to have an issue making your appointment time, we can reschedule that to a mutually convenient time, and that way we keep everybody on schedule. In addition, on occasion, not very often though, we may have some issues with our machine, and we will let you know as well if we anticipate there are going to be any delays and adjust your appointment time. But in general, we'd like to have you stick to the appointed time so that everybody can be treated in a very timely manner. We would also request that you not take any vacation or plan any time away during your radiation treatment course, because it's very important that we try to get through the whole series of treatments with no breaks or as minimal break time as possible. Each radiation treatment that you receive causes damage to the DNA of the cancer cells, and that damage accumulates as your treatments progress. If we have long breaks, it potentially allows the cancer cells to repair some of that damage and recover, and that's something we want to avoid if at all possible. The remainder of the discussion will depend upon the type of cancer that you have. So what I will do is when I meet with you in person, we'll talk more specifically about the side effects. It was very much a pleasure speaking with you, and if you have any questions, please write them down and formulate them in your mind, and we'll go through that when we meet. Have a nice day.